I'm Dr. Tracy Tyson. I'm a board certified general pediatrician. And what disease does this child have? So this child has something called Kawasaki disease, which is a very rare condition in children. However, I do feel like a lot of people have heard of it. They just don't know exactly what it is. So let's talk about it. Kawasaki disease, as I said, is an extremely rare condition in children, happening about 25 for every 200,000 children in the United States. That's a little bit more common in Japan, but is still extremely rare. We don't know exactly what causes Kawasaki. There are a few theories. Definitely viral and seasonal seems to have an issue because we notice clusters at the same time. So if one case comes in, likely there's going to be 2 or 3 coming more. So certain viruses, certain times of the year, we have a peak in winter and late spring in the United States. It is a vasculitis, meaning the blood vessels are inflamed where the immune system gets confused and attacks the blood vessels, which explains all the symptoms that I'm going to show you. There are some genetic factors, there are some environmental toxin factors, but it's so multifactorial, it's really hard to determine exactly what your risk factors are, but certain viruses of Asian descent and certain areas of the population, like urban areas, are more common. So what are the clinical criteria? Because there's no test for Kawasaki, it is all a clinical diagnosis. So there's things that your provider looks for. The first one is fever for more than 5 days. So if your child's running a persistent fever for more than 5 days, that is almost always going to trigger a doctor's appointment so we can evaluate and look for any of these other signs. The second one is this, what we call bulbar conjunctivitis, where the entire whites of the eyes is extremely red and inflamed. They look very bright. They're typically not painful and there's not a lot of drainage. So that's how you can tell the difference between like a conjunctivitis or pink eye. The third criteria is a rash. So we call this like a morbilliform rash. So it can be any kind of rash on the body. That's a third criteria. The fourth criteria is any kind of involvement in the hands and feet. So sometimes they're swollen, sometimes they have the same rash as the body, sometimes they actually peel and they can be painful. Another criteria is swollen lymph nodes. So all children can have swollen lymph nodes during viral upper respiratory infections, but in Kawasaki, they are greater than 1.5 centimeters. So if your child has at least 4 or 5 of these criteria, that will trigger a workup by your pediatric provider to look for Kawasaki disease. They would do blood work, they do an ultrasound of the heart called an echocardiogram, because here's the problem with Kawasaki. Those blood vessels are inflamed, so are the coronary arteries or the blood vessels that feed the heart. So children can be at risk for heart disease if this is left untreated. So it's extremely rare. There's 5 clinical signs. We can diagnose it with 4, but those are the 5 signs we're looking for. It can look a little atypical in younger children, but we're just going to start with the basics. The issue is the heart. They need to be put into the hospital. They need certain IV medications, and then they go on aspirin after to decrease the inflammation in their blood vessels. If this is left untreated, it is the #1 reason for heart disease of children in the United States. So I hope this helps a little bit. Again, thank goodness this is rare. We did see a decrease in Kawasaki during the COVID-19 epidemic because there was less people getting sick in general. And so it's starting to kind of make its uprise again as people are social distancing less and we're seeing more and more infections spread throughout our community. So we did see a little bit of a lull, but it's coming right back up to where it was. Again, extremely rare. Thing for you to look for in your child is if they have a fever for more than 5 days, you should definitely reach out to your provider. Obviously, if your child looks like this, you're going to be calling us anyway because the child looks ill. Most children with Kawasaki do look ill, so don't panic. You won't miss this in your child. I just want you to know what it is because I think people hear the trigger word and now you have more information. So the more you know. Take care.